Hello and welcome to another episode of the Hey Girl podcast. I'm your host, Donna Sheely. I'm really excited about today's conversation. We are joined with two very beautiful ladies. And the first we're going to talk about is Dr. Stephanie Young Moss. She is my sorority sister, member of Alpha Kappa Alpha Sorority Incorporated, but she is a doctor of pharmacy. She's a pharmacist, and she is the creator of, I love this website name, drstephanieyomo.com, and where you will find practical health and wellness tips, ways to reduce healthcare disparities, and simple ideas for health and wellness professionals to create meaningful content. She's also just viral on social media talking about perimenopause and menopausal symptoms, and she does it in such a fun and relatable way. So welcome, Dr. Stephanie.
Thank you. Thank you. Thank you.
You're welcome. And we're also joined by Sally Ann Rabin. She is a business management consultant who's actually transitioning right now. So anybody, if you're looking for somebody, she's here. But we met during the Super Bowl. And this is really actually our second time meeting, but we were sitting together at a lounge and just started talking. And I don't know, we just felt comfortable enough to talk about what was going on with us and dealing with menopause and our mental health. I don't know how we felt that comfortable to do it, but I'm glad we did because it brought us to where we are right here. And so that's what we're going to be talking about today. We're going to be talking about what I feel like is kind of a taboo subject, perimenopause, menopause, and depression, and even suicidal ideation. So it's a serious topic, but it's a topic that I feel like we're not talking about enough. So that is what we're going to be doing today. And ladies, again, welcome. Welcome.
Thank you for having me.
Thank you. All right. So Dr. Stephanie, we want to start with you and just give us a definition of what perimenopause and menopause is. What's the difference? What is it?
Well, perimenopause is a period in a woman's life when she starts to transition and stops producing hormones such as estrogen, progesterone, and then sometimes even her testosterone levels will kind of lower as well. So this is a transition period, usually it may start between the ages of 35 and 50. So everyone is different. Some people start on the earlier spectrum, and then some people start a little bit later. But it can last anywhere from 4 to 10 years. So your hormones are going up and down. You're starting to lose your reproductive ability, and you also have some mood changes and different things going on because of those estrogen levels. So people don't realize that estrogen affects like every part of the body, from your brain all the way down to your toes. And so that's why you start to get some of these signs and symptoms that we're going to talk about in a minute. But like I said, that's usually between 4 and 10 years. And actually, women of color, we actually will experience it longer and sometimes earlier than others as well.
Oh, wow.
So, yeah. But then menopause is after you have not had your cycle for 12 months and 1 day. That's when you consider to be menopause. Then after that, it's postmenopausal. So really, menopause is just like 1 day. It's that time your cycle stops for 12 months and 1 day, then you consider it to be postmenopausal. So, yeah.
Oh,
good.
see, I didn't even know that. Did you know that, Sally?
I did not know. I know the Perry.
Yeah.
Because I just started to find out about that because my cycle had stopped, and I was like, oh, fantastic. And then randomly came back. And then when I went to the doctor, they said, well, it has to be a full, she said just a full year, not that one day. So that's interesting. And I was like, I have to start over? Like, what? There's no pass on this? What do you mean?
Yeah, there's a lot of people that would go like 11 months and then it comes back the next month like, oh my goodness. So sometimes it just depends. They may just make a little surprise visit, then go away forever. But typically it's 12 months.
That's the 12. Okay.
Yeah, you've made a good point, Sally Ann, that there are a lot of cycle changes with women during that perimenopausal time. Some people may be very, very heavy. Some people may be light where they don't see it for 2 months at a time or 3 months at a time and it comes back. So just like any kind of cycle changes is typically a symptom of perimenopause.
Well, I guess for me, the hardest thing is even with this doctor, I think, they're fantastic, but no one talks about this. And if we, I found that just recently going through this, when people are talking about it, it's almost like you talk about it and you kind of skim over it. You make fun about, oh, you're having a personal summer or this and that. Like it's, it's just all jovial. Like there's almost a discomfort to really be like, I'm struggling. And gloss over and just make jokes and fun about this stuff that we all talk about, like, sweating and changing clothes, and it's all a joke, but there's not really the conversation of, this can really affect you and your emotional state, which I did not know. And I didn't research it a lot before because it wasn't something my family talked about. I have sisters. I have a sister who's in her 60s. I have a sister, and we've never talked about this. My mother never talked about it. So it's not anything that's ever been discussed with me. And the women that when I was younger, that were probably going through it, they just be sweating. I'm like, you all right? Or sitting in front of a fan, and you're like, why are you sweating so profusely?
Yeah, right.
They never discussed that this is what it was.
Right.
And that was the only, go ahead, Donna.
No, I was going to say that's why I wanted to talk about it, because I feel like we're not talking about it enough. But go ahead with your point.
Well, I was going to say that was one of the symptoms that we would always see. It was only the hot flashes. That's what we thought menopause was. At least I did. Because I would see my mother sweating. That was all I thought. It was just menopause was hot flashes. So since I wasn't having hot flashes, I didn't know the other signs and symptoms. And I didn't know that I was, going into menopause or that I was perimenopausal because I didn't have hot flashes. But I had a bunch of other things that I actually took to my own doctor that were dismissed. So I went to the cardiologist. She sent me to the cardiologist because I had heart palpitations. She told me to clean out my ears because my ears were ringing and itching. I had signs of anxiety and depression. They said, oh, it just may be seasonal, depression or seasonal, whatever. And none of that, no one talked about it possibly being signs of perimenopause. I had to end up doing my own research, and that's how I found out. And that's how I got more into it when I started seeing all of these different signs and symptoms that people were experiencing that they didn't know what it was.
Wow. Yeah. And so what we really wanted to focus on was the mental health aspect. So how our conversation came about when Sally Ann and I were talking, she was talking about her transition, and you can expound on it a little bit more, Sally Ann, about how she was feeling, with her job situation. You can share that now, Sally Ann, if you like, about what you were sharing with me.
It was, for me, I've always been someone that's, always, of course, enjoyed working, always worked long, hard hours. And then all of a sudden I felt like I wasn't coping with things as well, or there was the feeling of just getting through the day. I didn't have any joy one way or the other. Then even at home, I have a spouse that's, knock on wood, he looks amazing and he's still physically very attracted to me. And I was like, really? And so what really prompted this was that he said, you need to go to a doctor, you need to see someone, you need to take a pill for this, like what's wrong with you? And so I took him foolishly at first to the doctor with me, and he was asking them what drugs can they give me to make me get back into, like, he's the man. And they were like, sir, this is part of, perimenopause. And he was like, what? And so on one hand, it was good to have him there to not let him think that I was not attracted to him, but it was like the last thing on my mind. So I'm like, what is going on here? This is someone who I'm attracted to, but like I'd rather gouge my eye out right now. And then at work, I can't really get my head straight on some things. And I'm always used to having my list and I'm feeling anxiety, but I don't have anxiety because I'm a tough woman. I've got them a strong woman, black, yellow, pink, whatever. I'm a strong woman. I have this. I've been raised by a single mother, and I was struggling, and I was ashamed I didn't know where to reach out to. So I continued to be quiet. And just by chance, I said, I feel like I'm in the ocean. Like I have nowhere direction to go, and it's a horrible feeling. And I ended up leaving the position I was in, which at the time it was, the culture was never good for me. But I think for whatever reason that triggered that I just really can't do this anymore. But then with that came a lot of not understanding my own. Why would I do that? Why would I leave this position? What's wrong with me? Why am I feeling stressed out? And not really understanding that could be part of the symptoms. And it's interesting you said something about the heart flutters. I was reading some the other day, and there was a very famous person who said that they were having heart issues. They felt like they're having heart issues, and they kept going to the different doctors, and they kept diagnosing and saying different things. And then they were in an office and they picked up a pamphlet and it said one of the symptoms of menopause could be this heart, you're something with your heart.
Mhm.
And this is someone who can afford the best of the best. And I thought, why do we continue to not be open about information? It's like, why are we sometimes as women still so let's make it nice and pretty and so awkward to have this conversation?
Right.
And because what has happened, you have someone like me who has not had the resources or the opportunity to say, I need some help. Am I crazy? What's going on here? And not be like, there is something going on with you. So here's how you can, think of some ways to deal with it, but you're not, you're not alone. And
Right.
menopause is not only the hot flashes.
Yeah.
Exactly. And that's one of the main reasons why I wanted to start the community, because there are so many people that want to talk about what's going on with them. And so that they don't feel alone, that they know that they aren't going crazy. And I think with menopause is, as far as time is concerned, it's really a fairly new phenomenon if you think about the history of medicine, the history of health, right? First of all, we live longer, so we have to deal with it a lot longer, right? Instead of dying a lot younger, we live longer. So like menopause is a third of our lifetime that we have to be within menopause. And then also back in the day, it was taboo to talk about it. So even our grandmothers or our great grandmothers, if they were going through it, they weren't talking about it. If they made it to menopause, they weren't talking about it. Of course, right? So of course we talk about when you get your cycle, and some people don't even talk about that, but then they don't talk about when it ends and those things as well. So it's time for us to start to talk about it, so the next generation will want to be more open about it as well and know what to expect, so they will be able to stop some of the things that you talked about, Sally Ann.
Yeah.
I love that.
Yeah. And one of the things that we also talked about, Sally Ann and I was being transparent the week before that with me, I was just, the depression was just great. And I was just, I would come out of nowhere. I mean, it didn't really take much to trigger me. And I was just, I mean, even having, and it's even to say suicidal ideation, like the thought came in my mind, like, do I even want to be here? That type of situation. And I'm like,
Right.
what is going on? And I I don't know if I read something or I saw something. It's like, that is a symptom and can be a symptom of menopause or postmenopause and I was like, wow, I think maybe that's what was going on, because I feel like it just kind of came out of nowhere, and I've never been feeling that type of depression before. It was just
Right.
very, very dark and having frightened thoughts and those type of things. So, um, talk to us a little bit more about what you know and you're hearing about women dealing with that and not really talking about it.
Well, thanks first of all for being open and sharing your experience, Donna, as well. Thank you so much for being transparent. But I think that with the decrease and fluctuation of hormones, a lot of times that will affect mental health. And when you're looking at the United States, the highest rate of suicide in women, the age of the highest rate of suicide is between the age of 45 and 64. And I really don't think that's a coincidence if you think about it, because of all those fluctuations. So
Yeah.
it is always important, if first of all, if you're having those thoughts, there's 988. I have to make that, that disclaimer. If anyone's having those thoughts, that's the number that you can call for that. But then also talk to your healthcare provider to rule out anything else. But there have been signs, and there are studies out there that I've actually read from NIH and different other government agencies as well, that look at certain things like depression and like anxiety in women who are perimenopausal. And there have been increases that show that those are symptoms and signs of that. So some doctors or some healthcare professionals or even pharmacists will look at going straight to antidepressants, which I'm not saying that people don't need that, because there are some women that actually need antidepressants, but then they also need things like lifestyle changes. They need a therapist. And then also some people may benefit also from hormone replacement therapy. And that's what some of the first line of agent for you to take with and this is by science, this is not my recommendation, but by science, it's showing that the first line of agent is not an antidepressant, it's actually hormones to offset it. So there are some women who would need hormones, and there are some women who would need antidepressants, or both, or either or. So that's why you need to really talk to your healthcare provider to see which one works best for you, because so many people are just being medicated with that antidepressant, but they're not touching the other things that's happening to them as well. So talk to your healthcare provider, talk to your therapist, to talk to them about what's going on with you, because they are seeing a rise, and that is one of the main symptoms that people are experiencing with perimenopause or menopause. Sort of like what Sally Ann said, where either they're losing interest, they may be more, they may want to sleep more, they may not, like you said, may not want to touch their partner. So that's low libido, which is one of the signs and symptoms, but that also could be a part of the depression as well. And then also, like you said, suicide ideation. When people may not ever even thought about that, and then all of a sudden, like you said, that thought may pop into their head that they're thinking that as well. Sometimes that's that hormone fluctuation as well.
Yeah. And I do want to give a shout out to, I have very, very good friends. So I knew enough to pick up the phone and be like, hey, I might need you to come over here right now, and
Right.
thankfully one of my girlfriends was able to come over that day. She was free. So that was truly a blessing. But, I just,
Yeah.
yeah,
Everybody doesn't have that. So that's good
no.
you have that community, because everyone does not have that.
Right, right,
Yeah.
right. And what you were saying about, having a therapist, I do have a therapist as well. And so I'm grateful for that. But I think just having conversations to help people to know that they're not alone and not, by themselves. And with Carrie Ann and it's Carrie Ann, Sally Ann and I talking, it felt good to say,
Yeah.
okay, wait a minute.
Yeah.
Right.
I felt that this week too, and
Yes.
not feel alone. Yeah.
Right.
Yeah, that was
Exactly.
for someone, for some women, and maybe people who have some personality to me. In a sense, very private and very stoic. So it's not. I was upset at myself, like, what's wrong with me? I don't get depression. I've never had depression. I can just, get a cup of tea and soldier on. The old, just strength. And I really struggled, and I felt very insecure. I felt very disappointed in myself that I couldn't, come on, pull it
Yeah.
together.
Like, get it
Get it together.
together.
I
What's
didn't
wrong with
want to talk to
you?
anyone, and my spouse is used to this, this particular type of personality. And all of a sudden I am more tired. I am very insecure. I want to cry, and I won't cry because I'm angry if I cry, because that's weak.
Right.
Really, like, what is going on here? I'm feeling alone. I'm embarrassed to talk to anyone about it. I I didn't, I had a lot of shame with understanding the emotional part, the physical aspect, okay, that part, like you said before, everyone knows about that. But no one talks about the other aspects, which we're kind of speaking about today, so that if you have that, you feel like this is something that I can deal with, instead of what's wrong with me.
Right.
Something's wrong with me.
Exactly. And I think if our family, our grandmothers or great grandmothers, said they didn't talk to us about menopause, they surely weren't going to talk to us about depression. So even if they experienced it, they would not tell us that, right?
No.
So I think it is important to know that a lot of times when people are going through perimenopause, you will see some of the psychological symptoms first, because sometimes that will present different. So we're waiting on the hot flash, but the depression may hit us first, or the anxiety may hit us first. So we really don't know what it is, because we're sitting waiting for the hot flash to come.
Right.
Which is right. We're not thinking, oh, it could be because I don't have any interest in anything, or because my body aches, and which are all signs too of depression and anxiety. People have backache, body aches, all of those things can actually present as depression too. So we're waiting on the hot flash when we're already having signs and symptoms that we're not realizing that could possibly be perimenopause too.
Yeah. Wow. So for me, I've had a hysterectomy, but I still have my ovaries. And so I guess, what is that? Am I in menopause? Am I in menopause? Like, what? My post.
Well, you could still be producing hormones, because you
Right.
have your ovaries, right? So
Right.
it's just going to depend on because you don't have a cycle, because you don't have your uterus, you really won't know. The reason the way that they can tell is typically by signs and symptoms. So and actually, as a plug, and I hope you can put this in your show notes, I do have a checklist that's of no charge that they can take to their healthcare provider, just to get the conversation started. So it's not to diagnose or anything, but it's to get them to talk to their healthcare provider, to get them talking about it. But so they really can look at signs and symptoms and say, oh, we think that you are in perimenopause. But if you don't have a cycle, which I did not have a cycle either, I would suggest you can get a hormone panel taken to see exactly where your hormone levels are. Because I'm gonna be honest, I didn't know that when I was going through perimenopause, I had all the signs and symptoms. Like I said, no one said anything about it. And then I was like, well, let me get my hormones tested. I requested it myself.
Okay.
Once I got that tested, it said, you are in menopause. It didn't say peri. It said meno. I was like, wait a minute. I did all of this and I'm going through all this already.
Wow.
So, yeah, that was at my request. And like I said, I'm a healthcare professional. We've studied things in school, but we did not focus on a lot of the women health issues as far as menopause is concerned. And I think a lot of healthcare professionals are in that boat where they have to go outside to get their own training and their own, which is what I had to do, is go and look up do your own research. Thank goodness I'm a researcher by nature. I did that and was able to read and study myself to learn more about it, because healthcare professionals, if they are, let's say, an OBGYN, if they have not spent time on studying and learning menopause, if they don't have a large clientele of menopausal patients, they may be more focused on delivering babies. So think about your OBGYN. She was my baby deliverer. That's what she did. That's what she focused on. Yeah. So now her clientele is aging. So now she's moving more into that, where she is learning and educating herself more. So now she's able to help a lot more as well.
That's good.
I think that was a great thing you mentioned about getting the panel work, because the doctor that I go to, the nurse practitioner I've seen, but the doctor, he has been involved in the studies for a long time. And it's interesting because some of the other doctors, you see, they don't talk about it, they gloss over, and I unfortunately had to get just a general practitioner doctor, and the very young doctor, which is fine, but when I brought it up, I think he wanted to run out the room, and I was like, back once again and showing where it has. I read a great article where it said a lot of professionals are not coming out of the medical field going over that phase a lot. They're going over all the other stuff, but they're not really teaching these young doctors and some of the doctors been about menopause and the questions they may have. So the doctor that I'm lucky enough to have, and the nurse practitioner, he said, let's do the panel. And it showed I had like 99% no estrogen or something.
Oh, wow.
He goes, well, normally it's like 33. So might I make a suggestion? I was like, am I going to die? It's 99.
He said, am I going to die?
So he recommended some of the hormone treatment, a very low dosage, because I'm very anti anything. I have a headache. I'm just going to get through it. I'm going to have children.
Water. Yeah.
But I'll be okay. But I really thought that this could make a difference, because I want to stay married to this wonderful man.
Yeah.
But I also want to really be helping myself and not so ignorant of the good things that you can do for yourself if you're going through this, and not be listening to some of the misinformation, to take some time, because I'm not necessarily a researcher, but this has focused me to, you really need to have conversations like this, be open, and then also maybe read different things. Just wide what media may say or something. And that was where I learned, and I read about how when the estrogen, progesterone, I hope I'm saying those right, were done years ago, that the information wasn't necessarily given out as cohesively as it could have been. And some of the stuff that stuck really put a lot of women off of getting something that can help them. And
there was a study that came out in 2001 that you're talking about, where it showed that there were negative effects from a study that was going on from the NIH, or excuse me, WHI study, Women's Health Initiative study. So a lot of the women at that time in 2001, they just pulled them right off of hormones. Right? They just stopped taking the cold turkey. But there's so many details in the study. I wish I can go into it more, but a lot of the things that they were seeing, some of the increases that they were seeing within the women, it was women who were well over 60 or well over 65, and they were taking synthetic hormones. So now we have newer agents that are natural hormones, that are plant-based hormones, plant-based estrogen, plant-based progesterone. And that's not what they were taking then. They were taking synthetic. And then they weren't even women that were our age in the study. It was a lot older than us too. too.
Oh,
So they looked at all of that information. When they looked at some of the women who were in the study that were younger, it actually was beneficial to them. So there were so many details that were left out that people were just chasing a headline, right?
right,
They were just wanting to say,
right,
this is what's happening. Get off of your hormones, instead of
right,
going deeper in detail into the study. And so
right.
now we're just now going back to look and say, hey, these are some of the things that were happening. It did help some people, while some people do need to be careful taking it. And that's why it's important to talk to your healthcare professional to see if it's right for you. But I'm not going to say that everyone should take it, and I'm not going to say that, and of course, that no one should take it, but you should talk to your healthcare professional about your medical history and to see how it would work best for you.
Mm-hmm.
I do think that blood panel makes a difference because you see it in black and white, and they
Yeah.
go through, and it's not well, I'm having this and that symptoms. No, this is what your body is saying. There's some
Yeah.
proof right in front of you. For me, my personality, that was just so black and white that there's no fudging this. There's no let me interpret this. This is what your body is saying. Some ways that you can help yourself.
Yeah.
I think that's also to have a good relationship with your the doctor, whoever you have. And if they're not right, then I think many times, I know that I'm super polite and tactful. I may hesitate to change, but I don't feel that way anymore because this is, as you said, this is going to be a third of my life, and God willing, I live a long time. But I want to be happy. I want to be healthy. And if I'm struggling with an invisible enemy and I'm too ashamed to battle back, that just continues to put me at a detriment, and I don't want to be there.
Right.
So I appreciate that you asked me to be on here. You know, like I said, okay.
You're like, what are we talking
I'm signing up for, but I like you, you know, okay.
Sure.
Right.
Well,
But it's wonderful to be able to speak with you to hear some of the medical parts. And like I said, to see representation and have us be able to take care of each other.
yeah.
Yeah.
And that's what I also want you to kind of expound on, Dr. Stephanie, about Black women particular and the studies that you found concerning us in dealing with us, if you don't mind.
Yeah, well, in some of the studies that I've seen, women of color, we actually, I say women of color, but the study was in Black women. It was Black women. We actually go into perimenopause sometimes earlier, and then also longer periods of time. And then also our vasomotor symptoms, which are like your hot flashes and your night sweats, a lot of times can be worse than other races as well. And then also, we also go into menopause earlier. So the average age for Black women in menopause is 49. The average age in white women was 51.
Okay.
So when you think about that, when you think about commercials, you don't see anybody 49 in menopause, do you? You see the grandmother, you know, with the kids, and I know different ages have white hair, but typically she is like a great grandmother is what they show on television. They don't show people that look like us when you think about it. They don't show us. And the average age is 49 for Black women in menopause. 49. Yes.
Wow.
So of course, people say it's a long range. Some people may say, well, I'm 60 and I'm still that's why it's called an average, because it's different people, but the average is 49.
Yeah.
That doesn't hurt my feelings that it doesn't go away after like a year or two. So the fact
it does not go away. And that's what people say. I wish my cycle would just go away so these symptoms will go away. And that's not what happens. So just because your cycle is gone, some people will still have signs and symptoms. I actually spoke to someone the other day who was in their 70s and they're still having hot flashes.
Yeah.
So and they're not on anything at all either. Right. But some people may say, well, I never had a hot flash. But everyone's different. Some people will have hot flashes. Some people will have symptoms. Some people won't have anything. So people can't judge and say, well, it's not a big deal. I got through it. Well, everyone is different. Everyone experiences it different. Someone may not have anxiety, depression, or suicide ideation. Right. And someone may. So they just need to keep that in mind when they are talking about others' experiences and being respectful of not saying that it's not a big deal too.
Right. And I think just, in this conversation and just being transparent and kind of just calling it out so that if someone is listening and they are going through that and they're kind of wondering, well, where is this coming from? That at least puts that thought in their mind and say, okay, let me check with my doctor, my healthcare provider, because this might be because of menopause, and not feel like they're crazy or, or just
get it checked out first.
Yeah,
exactly. Get everything checked out, because even especially the the cardio or the mental aspects of it, rule out other things too. So that's why you should talk to your healthcare professional. Rule out other things as well.
For sure. Yeah, we would definitely want to do that. But I know, and speaking of Black women, we try and we talked about this too, Sally, and just being that strong I think this is from, like you said, our grandmothers and our mothers. They didn't really talk about it. They just kind of thought they were through
Yeah.
it,
Yeah,
and
don't
so
complain.
kind of feel that way. Like I'm not supposed to be crying. I'm not supposed to be whining about these night sweats and hot flashes. I got to be
Mhm.
strong at all times,
Mhm.
and so I think sometimes that fights against us of trying to be so strong, being
Right.
that typical strong black woman,
Mhm.
that when we do bump up against something like this, we're like, okay, wait a minute, this is not in line with my stereotypical black woman status here. What's
Talked
going
about
on
it.
Exactly.
No one's
here?
talked about it.
Exactly.
Mm-hmm.
So
Well,
that's the thing. No one's talked about it. Going back to what you were saying
exactly.
Yeah.
earlier, Dr. Stephanie, was something you said about, the age it can start at. Like I'm going to be, 55 a couple of months, and I didn't have my cycle all the way through till probably just towards last year. And I remember
Mhm.
saying to my doctor, it's going to miss me. I mean, I'm over 50 and it's not going to happen to me. And
Right.
she would just smirk and be like, no, Sally Ann, it happens to everyone. I'm like, no, because, I work out and I'm not having any hot flashes. And
Mm-hmm.
that's what I thought it was the hot flashes. And so I think that was, and I'm an educated woman, but
Mm-hmm.
I thought because I wasn't having hot flashes, like my hairdresser was having them since she was 45. And I'm like, girl, what is wrong with you? Would you like to, why are you so sweaty? You're like younger than me.
Right.
But when you see that Black women do go through it early, I did not know that. I think that's really interesting. And
Mhm.
and for me to think that I was it's going to miss me because I'm special.
Mm-hmm.
But then B, because I was focused on the hot flash aspect,
Yep.
Right.
not all
Uh-huh.
the other aspects. And it's my older sister was here recently, and I said, I think I'm going through hot flash. And she said, yeah, I went through that when we lived in Arizona. And I
Mm-hmm.
remember now some really weird things she was doing and some behavior. And I was like, what is wrong with her? Like
Right.
she's just so off, not understanding. Now I look and think, oh my gosh, she was going through all this stuff. And I didn't have a clue. I just was like, okay, she's being totally weird.
Mm-hmm.
Mhm.
Like
Yep.
weird and bizarre.
Yeah.
Yep.
Yeah.
One of the from the study that I read that we talked about earlier for women, for Black women, the reason why we do sometimes go through it earlier,
Mm-hmm.
it pointed out stress and it pointed out structural racism. So
Mm-hmm.
health disparities, all it said it had a lot to do with the women going through it early as well. So I
Yeah.
thought that was very interesting when I'm talking about the study and looking at it, like, why is this? And
Right.
that's the main thing to point out is that some of the reasons why is because of the healthcare disparities as well.
Yeah. Well,
Health
if you
disparities.
had to give us some bullet points on some final advice when it comes to, dealing with the perimenopause and menopause and just maybe having depression and these
Mhm.
thoughts, what are some bullet points on things that we should do?
Oh, I think the main thing is talk to someone
Mm-hmm.
and make, like you said, like you guys talking to each other and
Mm-hmm.
having that community and being able to share, you know what? I'm not crazy. This could possibly be perimenopause. Talk to
Right.
someone, talk to your healthcare provider.
Mm-hmm.
Start to keep a journal of how you feel when you do certain things. Is what I like to do. What did I eat
Mm-hmm.
today? Did I work out today? Did I get sleep today? And then see how that makes you feel. Like for me, when I wrote down, oh, I had a glass of red wine, I got a migraine and I didn't sleep well. Maybe I need to stop drinking red wine as much, or maybe I need to switch to a different type of wine, or maybe I need to stop drinking, altogether. So
Right.
look at those types of things of what you eat, because things like spicy foods, alcohol, caffeine, all of those things can kind of weigh upon either your
Mm-hmm.
vasomotor symptoms like hot flashes and night sweats. But then also look and see as far as your mood. If I worked out, did I feel better? If did I not feel better? So kind of keep a journal of those types of things day to day. But then also, I think the most important thing is having a community and talking to your healthcare provider and not taking, oh, it couldn't be happening to you. You're too young, which I've had
Mm-hmm.
people saying their healthcare professionals told them that.
Yeah.
So if they're not giving you the right answer, find someone else who actually knows more and that you can talk to about it as well.
Well, awesome. And, thank you for what you're doing, because you're doing that on social media by having the post on Instagram and TikTok, and where people may not have anybody talking to them
Yep.
about these
Mm-hmm.
symptoms. This is the very first time they're hearing about, oh, that could be, I did get chills, or, whatever.
Right.
And you're actually telling and showing. I love the way you do it. And guys, make sure in the show notes you'll see her Instagram, and make sure you follow her and her TikTok, because even though it's, you do a little humor with it, it's so important, because you might be the only time someone may see, or during their day, just by going through social media. So
Yeah, and I
thank
just
you
wanted
for
to make
that.
sure that people are able to see it and talk to so they'll know to talk to someone about it.
Yeah.
Because like I said, I didn't know about all the signs and symptoms. So
Mhm.
I want them to see it. I want them to be able to laugh it off, but then
Mhm.
also take it serious and go talk to someone about it as
Yeah.
well.
Yeah. So thank you. So again, we'll have her information in the show notes, guys, and you can follow her on Instagram and you can follow her on TikTok. You do it on Facebook as well?
Yeah. Yep, on
Okay, and
Facebook
she
as
does on
well. Yeah.
Facebook, and we'll also have her website there as well, so that you can, reach out if you need something or want some. And then we'll put the checklist. You said you had a checklist, and we'll make
Yes.
sure we have that in the show notes as well.
Okay,
And
great.
so, thank you so, so much for taking the time. And listen, we are here for each other. So I just want, this is why I wanted to do this. We want to offer our support and advice. Of course, we know to always go to our healthcare provider, but just as a sisterhood, to say,
Yes.
hey, this is what's going on with me. And so again, and also, Sally Ann, thank you for just being with me. And I know we just met. So transparent. Sometimes you connect with people quickly. It doesn't take a long time. And I felt like that's what we, did that night. And I'm so grateful that you were able to join us
It's
as
my
well today.
pleasure.
Thank
I definitely want to say, speaking up has helped me. And if you're like me and you're very private and very stoic, it's okay to, when the time is right, organically, like today, to, if there's something that connected with you from this, I definitely say, don't be ashamed to say, I need to talk to someone.
you.
Because that was my thing, a lot of, I didn't want someone to think that I wasn't strong or I
Mhm.
could handle it. And I'm really happy that I have options. I don't have to
Mhm.
go with everything that, as Dr. Steph was saying, but I will find what's right for me. But I feel a freedom
Yeah.
in knowing that this is part of my transition.
Mhm.
And it's just something else I can deal with, because the not knowing and that crazy feeling of I can't focus and this and that and what's going on and no one's talked to me about anything. It was
Yeah.
horrible. It
Yeah.
is horrible.
It
So
is.
it's good
Yeah.
to know that, okay, this is part, I can deal with it, because I
Yeah.
know that it's something I can deal with.
And you're not alone. Yeah.
Not alone.
Yes.
And you're not
Yes.
alone. Very good. Dr. Stephanie, any final thoughts for us?
No, just thank you both for being open and honest and transparent and sharing. It's really going to help a lot of people
Yeah.
to know, like you said, that they're not alone. They can talk about it and they have other people that are going through the same thing.
Awesome.
Thank you for
Awesome.
having me on. Appreciate
Yes.
it.
Thank you,
Welcome.
guys. Thank you all so much. And thank you all for listening to the Hey Girl podcast. I'm Donna Shealy. Have a great rest of your day. And let's go. All right.